Good day to our viewers. Welcome to SHEQ Matters. On SHEQ Matters, we dissect topics around occupational health and safety, environmental management, quality management, as well as food safety. My name is Tandwen Lovu and I will be your host on SHEQ Matters. Today, as we commemorate the World Day for Occupational Safety and Health at Work, I am joined by an occupational safety and health practitioner and an occupational medical practitioner to help us dissect topics around occupational health and safety. On my immediate right, I am joined by Mr. Governor Chamboko, who's an occupational safety and health consultant at OHSMS. Mr. Governor, welcome.
Thank you, Tanya, for having me.
Right. On my far right, I am joined by an occupational medical practitioner, Dr. Matare. Dr. Matare, welcome.
Thank you, Tanya, for having me.
All right. Thank you so much for joining me today on this conversation. Without wasting any time, Mr. Governor, the theme for this year's day is acting together to build a positive safety and health culture. What does this theme mean to you and what is the significance thereof?
Thank you, Tanya. When it comes to occupational health and safety management or creating a safe working environment, it requires a holistic approach. By holistic approach, what I mean is it takes a lot of concerted effort from different professionals in order for us to create a safe working environment. I'll give you a few examples or scenarios. It is very important for organizations, say, to conduct hazard identification and risk assessment in order to create a safe working environment. So, health and safety practitioners or occupational health and safety practitioners, thus health and safety officers at workplace or health and safety managers at workplace, on daily basis they conduct that process because they are the ones who are on the ground on daily basis and they identify the hazards. But it doesn't end there. Once you identify hazards, say you now want to control the hazards. If you look at the hierarchy of control, we have what we call elimination, we have what we call substitution, and we have what we call engineering controls, administrative controls, and PPE. Let's look at the component of engineering controls. It now requires engineering initiatives or measures to be put in place in order to reduce the risk of the hazards identified. That alone, it means that you need an engineer. For instance, say you have an equipment that is making a lot of noise which goes above the acceptable limits by law, then you would need some engineers, say, to redesign the equipment to ensure that it does not produce a lot of noise. That's an engineer. If an organization is to comply with a quite number of pieces of legislation in terms of occupational health and safety, you need to come up with what we call health and safety legal registers, which outline different pieces of legislation that organizations subscribe to. That alone will bring in a lawyer. So legal practitioners will work together with health and safety officers to identify all the pieces of legislation in terms of occupational health and safety management. If you are to come up with a wellness program at workplace, you will need an occupational medical practitioner, you will need dietitians, you will need psychologists as well. So, in short, I would say acting together brings different professionals that play different roles that will then integrate in order for us to create a safe working environment. Right. To be specific, say, to the workplace, acting together would allow the employer and employees to come together and draft different policies, draft different programs that will be then implemented by the organization to create a safe working environment. So it is a call for different parties to come together with their different expertise and experience and play a role towards identifying some hazards, towards reducing work-related injuries and illnesses. But above all, what I would say is there are key players now that should be on the ground for us to create a safe working environment. These are occupational health and safety officers or managers or practitioners and occupational medical practitioners. Other players will come on board, but only after identifying the need of them being part of the team. But on daily basis, you would need occupational health and safety practitioners as well as occupational medical practitioners such as Dr. Madar.
Mr. Governor mentioned the importance of occupational medical practitioners in the space of occupational health and safety. Doctor, you've worked with quite a number of reputable companies. Tell us, as an occupational medical practitioner, what is your role in occupational health and safety management?
Thank you for your question, Tandy, and Governor, thank you for that comprehensive introduction or your take on the theme for this year from the ILO. Like we said, it is about everyone coming on board to ensure that workers are safe at work or to create safe working environments. When you spoke of this multidisciplinary approach to ensuring safe working environments, one other aspect I always think of is the role of governments or agencies and other institutions that are involved in ensuring that everything that needs to be done is actually enforced, because most of this work is actually according to the legislation and the laws that must be followed. So we need to bring on board also governments and also some of these inspectors that come to inspect factories and so on. So our work from this theme, ensuring that we all play a part. Our part as occupational medical practitioners and other disciplines in the health sector is to ensure that that worker who comes, first of all, to work in a particular industry, particular workplace. When you put them on a particular place where they should work, as they conduct their work, you want to make sure they are safe to do that particular work. It may look very simple that someone can be employed. They've got the experience, they've got the education, they seem to know what they are supposed to be doing, but they can't work. They are not fit to work. For instance, if it is a pilot, the person is supposed to have good vision and all these things. If you employ them just because they've got a good experience, but they're not fit to do their work, then there is a problem. So our role as occupational health practitioners or occupational medical practitioners is to say, this employee that you want to work in this particular work, they meet the minimum standards of fitness to do that work. Simple things like if you're going to be having someone coming to work in a place where 4 of them are required to lift a heavy object, and one of them is not fit to do that. What it means is they've got 3.5 men, or probably only 3. So it means the other guys 3 are going to have to carry the weight of the other guy. And if they can't then lift properly, it means this thing is going to fall down. Either these guys are going to get injured or others are going to get injured as well. So which means by having an employee who is not fit to do that work, you have created an unsafe working environment. And then we also do what is called medical surveillance. Like what Governor just mentioned. When you've done your hazard assessment, hazard identification, you've done the measurement, say for noise and all these things through the hygienist. We are saying there's a possibility that any of those hazard control measures have failed, from the engineering controls to the PPEs. Any of those have failed, which means any of those employees or all of them might have been exposed to the extent that they've lost some function in their body. There are some physical effects from that exposure, whether it's hearing, whether it's something that is going to the blood and so on. So during the medical surveillance, we want to make sure that the control measures have been sufficient enough not to affect the people. Now our tests are going to be based on what these people have been what they would have identified as the hazard. If the main hazard is noise, what we do is now to do noise or hearing tests for them continuously. So we want to make sure that if we see that none of those workers have had their ears affected, which means the control measures are correct. If we see that some of the employees are having their hearing already being lost, it means we need to speak to them again and say, guys, you are the safety officers. May you go back and improve on your hierarchy of control. So that's our role, to ensure that the employees are fit before they go and do any particular task. And you also measure their level of fitness on a continuous basis. So that's our role, before we even call other disciplines. But that's our core function.
Right. Doctor, you mentioned that these tests should be done continuously. Can you tell us how often should medical surveillances be done or conducted?
Yeah, we don't have a set thing. There's no one size fits all plan. It depends with the industry. And also the other factors that you need to put in place. Legislation is also important. For instance, according to the Directorate of Maritime Affairs, if you're examining seafarers, these are the sea-going crew, the guys who go out there, the men and women who go out there and do the fishing, they need to have their test done every 6 months. For others, you can go to 1 year, but it all depends with the risk, you see. The risk that this employee brings to work, if the person is not fit, and they need to be continuously fit, depending on their occupation, you need to do them more frequently. And then for some, where the risk is to the employee, depending on where they are working. For instance, someone working with batteries where there's late exposure, you need to do that every 6 months. Because if you wait until it is too late, then that person would have already suffered some serious health consequences. So as occupational medical practitioners, we look at what is happening in the industry. So we've got different sources of information, published research, what we learn from our associations, our colleagues, and also what legislation says. Because if you look at that book, for the Ministry of Labour, the Labour Act, it will tell you exactly for employees who are exposed to certain hazards, there is a set frequency for which you need to do medical surveillance. But to answer your question shortly, it all depends on the exposures that these employees are exposed to.
Doctor explained to us extensively the role that occupational medical practitioners play in terms of occupational health and safety management. Mr. Governor, you've worked with quite a number of reputable companies internationally and locally as a consultant. Tell us, what is it that companies need to do in order to create a safe work environment? What is their role in this acting together?
Thank you, Tandria, for the question. There are quite a number of initiatives that organizations may adopt to create a safe working environment. I'll start by occupational health and safety policy. It is very important for organizations to declare their commitment towards creating a safe working environment. This can only be done by coming up with a very comprehensive occupational health and safety policy that sets the overall safety agenda of an organization. The policy also helps to declare the commitments or show the overall direction that the organization is going to take when it comes to dealing with occupational health and safety issues at work. Now, after coming up with a policy, it is very important to come up with programs that support the implementation of the policy. If the commitment is to create a safe working environment by identifying hazards that are associated with the operations of the organization, then there should be a program to do with hazard identification and risk assessment. That includes drafting comprehensive hazard identification and risk assessment procedures and say checklists that will be now used as tools by those who are on the ground. For instance, an occupational health and safety officer or occupational health and safety manager would need a procedure that will help them to identify the hazards. You will need a checklist that will be a tool that you use on a daily basis when you are conducting the process. Why is it important to identify hazards? As you may know, there is a quite alarming statistics that comes from ILO in terms of the number of in terms of incidents at workplace. So identifying hazards is very important because it will make the organization understand or know the sources of harm within the workplace, which may be associated with the equipment that they use, which may be associated with the general working environment. It may be associated by the behavior of employees or the systems that they have in place. Then, once you identify the hazards, it's very important now to determine the controls. And as I mentioned earlier, when you are to control the hazards at workplace, you follow what we call a hierarchy of control, which is elimination, substitution, engineering controls, administrative controls, and PPE. Right. Once you have identified hazards, there are other initiatives such as incident investigation and reporting at workplace. Some of the hazards that have been identified at workplace may not be fully controlled due to some reasons, and that may result in some incidents at workplace. So once you have some incidents at workplace, it is very important to conduct an investigation that will then help you to determine the root causes of the incidents, with the objective of coming up with what we call corrective and preventive actions that will help to, say, avoid the recurrence of some incidents at workplace. So that's one important tool or initiative that organizations should take. Besides that, employers should also work in compliance with various pieces of legislation. For instance, here in Namibia, we have Labour Act 11 of 2007, whereby minimum requirements are set on what the employer is expected of by law. For instance, ensuring that all the systems of work, machinery, plant is properly maintained in time to avoid issues whereby employees' health and safety is adversely compromised. Apart from that, the Act also requires the employer to ensure that employees are provided with the necessary information and also trainings on occupational health and safety. Right, I want to link these two. We mentioned the issue of a policy, we mentioned the issue of hazard identification and risk assessment, right? Employees need to be given adequate information so that they may understand the hazards associated with their work activities. If they don't have that understanding, then you will find out that you may have a very comprehensive process of hazard identification and a risk register, but that will not help much in terms of creating the safe working environment, because you have it on paper, but the people who are on the ground, who are responsible for executing different activities, they are not aware of the hazards associated with the work. So it is very important to train employees so that they become aware and they will be able to execute their duties competently. I will also explain the issue of coming up with what we call standard operating procedures, or SOPs. Right. Mainly SOPs are put in place to ensure that you control all the activities that are associated with the significant hazards at workplace. Not each and every activity or not each and every hazard would require an SOP, only significant hazards. So now, it is very important for safety officers, for the management, to identify all the activities that have significant hazards and come up with SOPs that are meant to reduce the impact of such hazards on the employees or to eliminate them completely. So now, besides SOPs, besides hazard identification, besides training, it is also very important for employees to ensure that they take reasonable care of their own health and safety at workplace.
Right.
So those are some of the things that organizations should do in order to create a safe working environment.
Right. Mr. Governor mentioned the role that employers are supposed to play, and he also touched on the importance of employees being aware of what they're supposed to do or conduct themselves at workplaces. Doctor, do you think that employers and employees are aware of their role in the area of occupational health and safety?
Not everyone does, so that's unfortunately. I think it depends with organization to organization, and like I mentioned also, employee attitudes are very important. Right. They know already that from the hazard identification, when they were put on that particular task, they were informed they are working with materials that have got a significant effect on their health. And they're supposed to be handle them in a certain way, or for them to wear PPE at all times. But most times they don't. They don't follow procedures. That's why it is important that they follow procedure. I've been to many places and they tell me, and I go there, I do a health risk assessment. the qualitative one, a walkthrough that OMPs can do before we call health safety officers or hygienists. When you go in there, you'll find employees are not wearing their PPEs. And you ask the manager or the safety officer going out, the question or the statement that they all say is that we provide them with these things at all times, but these people, they don't wear them. Right. They have to write letters, they have to write statements, they take them to disciplinary action so that if anything happens to that employee for not wearing their PPE, at least they are covered because they say the people don't follow instruction. Mm-hmm. I also wanted to touch on what Governor said about the hazard identification and the reason to come up with the health risk assessment reports. We also need that one. That is our main input, input for us to prepare what we call a medical surveillance exercise or medical surveillance plan. Because our medical surveillance plan must be risk guided. Mm-hmm. We cannot plan to do blood tests on employees who have no exposures that need to be tested in the blood. Mm. So we need to use their health risk assessment report, and we design it so that employers only have to invest in tests that are linked to their employees' exposure. So that's why I say there's no one size fits all plan. So when we come in to ensure that the employees are safe, it must be based on what these gentlemen would have done in their discipline.
Right. Sure.
Just to add something, Doctor mentioned a quite interesting issue, something that I've also observed for some time. Issues of employees working without PPE, mm-hmm. or maybe not putting the PPE correctly and consistently. Right. Then it also brings in the aspect of organizations to ensure that they appoint what we call health and safety representatives, in line with Section 43 of Labour Act 11 of 2007. Mm-hmm. Then health and safety representatives now who help to identify such issues, since they will be working with the employees on the ground. Okay. Because health and safety representatives are elected from fellow employees or colleagues in the same department or section. And they are supposed to pick such things and convey the information to health and safety officers for immediate corrective actions to be taken.
All right. Thank you so much for that contribution. We'll take a short break, and after the break, we'll continue the conversation on occupational health and safety management. Welcome back to SHEQ Matters. Mr. Governor, the ILO estimates that over 2.3 million men and women succumb to work-related accidents and illnesses every year. That translates to over 6,000 deaths every single day, which is quite an alarming figure. Tell us, what are the major causes of accidents at workplaces?
Thank you, Tandra, for the question. There are quite a number of causes of incidents at workplace, but I'll take you through the major ones. In most cases, you'll find out that incidents are caused by poor systems of work. Right? If you don't have proper systems, like you don't have policies, you don't have safety rules, you don't have, say, standard operation procedures, then that may also that causes some incidents at workplace. How? I mentioned earlier that standard operation procedures are developed after hazard identification and risk assessment. So now they are meant to guide employees on how to execute their tasks safely. In the absence of such SOPs, quite a number of incidents are recorded at workplaces. The other issue is hazard identification and risk assessment. If hazard identification and risk assessment is not conducted properly, and some of the hazards at workplace are not identified, say either from the equipment you're using or from the general environment itself, that will result in some incidents at workplace, such as slips, trips and falls. And also the other issue is the people, employees themselves. There's what we call behavior-based safety. The attitude of employees, if it is not safety-oriented, that will also result in some incidents, whereby employees maybe just take some shortcuts at workplace. They are not following the procedures. They are not following the safety rules, and they are doing horseplay at work. So it is also to do with the attitude. And employees, if they are not equipped with the necessary information and training, where they are not competent enough to execute their duties safely, that also may result in some incidents at workplace. So it goes back to the issue of how prepared organizations are in terms of health and safety management. Hazard identification and risk assessment is very key in terms of avoiding some incidents at workplace. You mentioned the issue of occupational diseases. You mentioned the issue of illness, right? All these, they come due to exposure to certain hazards at workplace. So I would say the major cause of incidents at workplace is exposure to hazards at workplace.
Right.
Yes.
Doctor, from the 2.3 million men and women that succumb to work-related accidents and diseases, 1.7 million of these are caused by occupational illnesses. Tell us, as an occupational medical practitioner, what are some of the common illnesses that you deal with and the causes of these illnesses?
Thank you for that question. In fact, those figures are quite alarming.
Right.
But as alarming as they are, the actual alarming fact is that it's actually an underestimate of what's actually happening, because those figures are probably what is reported. There's always serious underreporting. Like I mentioned, if there are no proper safe work systems, and if you have an unethical business owner or business owners who hide hazards, who hide or do not report those hazards in that workplace, it means many people are actually suffering without knowing. If you know, you might have heard the issue of in South Africa about the gold, the mining industry, and what is happening now. There's now a Class Action Act where some of our grandparents were working in the mines in South Africa, and only now they are now trying to get compensation for the occupational lung disease they suffered during that time. It was because at that time, because of the leakers of colonialism, the gold rush, the people we were working there were not being tested for or properly being recorded as having occupational lung disease. So the issue of reporting of the occupational injuries or occupational illnesses and having doctors in place to do proper medical surveillance and recording them and acting on them and reporting to national agencies is the reason why we may think those numbers are high. They're actually higher than that. So we have a role to play as the companies who own this, who have got employees working for them, where hazards have been reported. The next thing you need to do is to make sure those employees are periodically examined in line with the hazards that they are going to suffer from. If you know that you've got chemicals that they are exposed to, you need to know which chemicals they are exposed to. As a safety officer, I'm sure one of the things you do is when a material is being brought into your workplace, one thing you must request for is, let's see the material safety data sheet so that you know which chemicals are there. Then working with the occupational medical practitioners, we don't know employee 1, employee 2 are exposed to this particular chemical. So what should we be doing to monitor the health effects on that particular employee? it doesn't have to be on the whole company, because some of these people, they are only handling when it is covered. But there's one person who's going to be the end user. So let's know what are the potential health effects on that person so that you can monitor them. So the real issue is that many companies are not using occupational medical practitioners to help them with the medical surveillance. So if there's no medical surveillance program, you will never know which occupational illnesses that their people are being exposed to. Right. And also, look, people move from one job to another. Job migration is quite high. So someone was working in this company using these chemicals, and then the next thing they are working in a mine where they're exposed to other, and during that time at exit, nobody knows what their health status was at that particular time. So there are many people who are suffering and carrying occupational illnesses for which they don't know from which company they got from. So if we know what people are getting into and what illnesses they're getting from their illness, from their workplace, we'll be able to go back and work with safety officers and the companies themselves to improve the exposures. Because there's no work that is no hazards. Sure. It's inherent in the nature of work. There are always going to be hazards. But if things are done in a proper way, like medical surveillance is part of what you mentioned, occupational health and safety systems. There must always be that. And then we've got companies that think when they've got a health and safety officer, so they are sorted. They don't need doctors. And then you've got doctors who do their work, and then safety officers do their work. There's never, a coming together of these very key disciplines. Without these two, definitely, or if they work independently and they don't share ideas, they don't compare notes like people say. They compare statistics. What is happening? What have you done from what you did last time? The intervention that the safety officers bring into the company, I must be able to see it also. So if companies are data-driven or information-driven, you'll be able to see what impact each one of us has on the output, which is we've got safe workers here. Our environment is safe because every time I do medical surveillance, for instance, I'll be able to come to the managers and we sit together as working together, is it, to reduce workplace injuries and illness. Then you say, Governor, in this year we had 10% of the employees who are in the noise exposed area, 10% of them had noise-induced hearing loss. Yes. Our target should be that by next year, when we improve our control measures, we must reduce this by 5%. So using that data, which is targeted, which is using the smart idea, we do whatever we do, we've got targets that are measurable, that are time-based or time-framed. We'll be able to know that what we are doing now improved the health of workers in these past 2 or 3 years that we've been working together. So there must be data that determines how the safety systems are working, getting all those disciplines working together.
Right. Doctor and Mr. Governor, you've mentioned quite a number of times that organizations should have occupational health and safety management systems in place. Could you briefly walk us through the importance of organizations having occupational health and safety management systems?
Okay, by definition, actually, an occupational health and safety management system brings together different processes that are related in a coordinated manner that allows the systematic management of occupational health and safety issues at workplace. So, occupational health and safety management systems are very comprehensive. And once you have an occupational health and safety management system at workplace, it means that a quite number of programs are going to be put in place. For instance, an occupational health and safety management system requires an organization to have a health and safety policy, which I have explained its significance earlier. It also requires the drivers of occupational health and safety issues at workplace. That's occupational health and safety practitioners, occupational medical practitioners, to ensure that they come up with various programs, such as we mentioned the issue of hazard identification and risk assessment already. It also allows organizations to come up with what we call a training matrix that identifies all the relevant trainings that should be given to different people at different levels of the organization, depending on the tasks or activities that they implement at the workplace, as well as the hazards associated with such activities. Occupational health and safety management systems also require organizations to comply with all the applicable pieces of legislation. That's where you find organizations bringing in different experts, such as legal practitioners, health and safety practitioners, and also other professionals within the ecosystem of creating occupational health and safety. So they come together and come up with what we call legal registers. And legal registers are very important in the sense that they allow organizations to align their activities with the requirements of the law. We mentioned the issue of health and the issue of occupational health and safety representatives.
Correct.
If you don't have a legal register, you might not even know that according to Section 43 of Labour Act 11 of 2007, you are supposed to appoint safety representatives as long as you have more than 10 employees. Right? Legal registers also help organizations to ensure that they reduce the cost that comes with non-compliance. For instance, say you have exceeded some certain limits, acceptable limits by law in terms of noise. You'll be fined for that. And it's a cost to the organization. So I would say an occupational health and safety management system is very important due to a quite number of elements that constitute the system. The other element that comes with the system is the issue of training that we mentioned earlier. It requires organizations to ensure that there is what we call needs-based training. You don't just conduct training at workplace. You need to identify the needs based on the work that you do, based on the hazards that are associated with your work. An occupational safety management system, occupational health and safety management system requires organizations to do what we call continual improvement. This can be done by setting objectives at different levels of the organizations. Objectives can be at organizational level, they can be at departmental level, they can be at a section level. However, all the objectives should be aligned to the organizational, to the objectives at organizational levels. These objectives and targets, they are put in place to ensure that organizations drive health and safety issues towards a certain direction, towards a certain milestone. Then from there, you come up with programs that now translate objectives into action. Right. From there, continual improvement can be easily achieved. It also allows the audit of occupational health and safety programs at workplace, whereby you objectively obtain evidence to check whether the systems that you have in place or the programs that you have in place are meeting their intended goals.
Correct.
So, an occupational health and safety management system is very important, and it will help organizations to systematically manage occupational health and safety issues in a coordinated manner.
Right. Yes. Thank you so much for that very detailed and comprehensive explanation on the importance of occupational health and safety management system. Doctor, one of the things that Governor mentioned is the issue of organizational objectives. I would like to hear from you, Doctor. In conclusion, what is your perspective on the adoption of occupational health and safety by organizations?
Yeah, it's like I said, it depends from industry to industry, but it's not widespread. And one of the reasons why you don't find some of the organizations that must have them in place is because someone who's supposed to enforce the implementation of those systems that he's talking about, he has not come to them to ensure that they have them. You know, it's always about it's called moral hazard. If someone is watching you, you don't do it. Right. Yeah, and then you wait until something happens and you realize, no, it's supposed to have been done. So the issue of organizations not doing what they're supposed to be doing is because if you've got a company with terrible work ethic, they will not take their workers seriously, so they don't put systems in place. And some of it comes from ignorance. They don't even know what they're supposed to do. Let me give a perfect example. If you need a medical surveillance program, that can only be done by a qualified and a registered occupational medical practitioner. There are many shortcuts. We spoke about employees taking shortcuts. Employers are taking shortcuts. Some of them, they know it, some they don't even know. So they go and take an ordinary GP and they say, just examine our employees, tell them that they are fit. They give them fitness certificates, but at law, those certificates will be invalid. We have had to redo some of those certificates for other employees, or those re-examinations for other employees, some workers, because if the doctor who has done so is not a registered occupational medical practitioner, because they're qualified like that and they are registered with the Ministry of Health, then whatever medical certificate or medical examination they do is recognized. Anyone else should not do that, and that examination will be invalid. So if these workers or these organizations or these workplace owners know that this is the system I must follow, this is the minimum qualifications, the experts who are working with me, whether it's doctors, the safety officers, hygienists, and so on, what are the minimum qualifications they must have and the accreditations they must have? Then you know that that person or that organization is following the rules. So it is important that workers are trained, but most importantly, it is the education that must go to the owners of these operations, these mines, these factories, these industries. There's a lot of learning that needs to go there. So I would, in conclusion, say that the government needs to do even more. And we've got institutions like the municipalities where these operations are taking place. Before a factory is registered, as part of the factory registration process, they must be required to have a medical surveillance and occupational health and safety system that has got safety officers, that has got medical surveillance in place. We've got social security. Social security department will always be receiving reports of injuries. One of the things they must do is, let's go to that company and ask them, do they have any occupational health and safety policy and a system in the medical surveillance program in order to reduce the injuries and the potential illnesses? So my take would be more needs to be done. If we need to reduce that number of 1.6 million workers who are getting injured every year, and about 6,000 who are reported to be dying every day, which is over maybe times 10 of that, because most of them remain unreported. So we need to work together, bring all these agencies together, and have more of us in the system to come up and say, we need to protect the workers, and let's work together on that score.
Thank you, Doctor. Mr. Governor, what are your closing remarks on what we've discussed today?
Thank you, Chandra. Occupational health and safety management requires a holistic approach. That's point number one. Point number two, the nation, organizations, and employees should play their respective roles when it comes to occupational health and safety management. The nation should ensure that the necessary pieces of legislation are enacted and are being fully enforced. Employees should also make sure that they create a safe working environment that will not cause any adverse effects to the health and safety of employees without any charge to employees. Employees should also take reasonable care for their own health and safety at workplace. And it is also very important, as I mentioned earlier, for organizations to adopt best practices in terms of occupational health and safety management, and also adopt occupational health and safety management systems, institute different programs and mechanisms that will help to identify some hazards at workplace, hence creating a safe working environment that will be free from injuries and illnesses. It is also very important for organizations to ensure that they bring competent professionals or personnel in the field, in the ecosystem, in the field of occupational health and safety, and support professionals that will help health and safety professionals to create a safe working environment. That's what I would want to say today.
All right. Dr. Matare and Mr. Governor, it has been a pleasure having you on this show. Thank you so much. I think the discussion was quite comprehensive and really exhausted the theme of this year, which is act together to build a positive health and safety culture. It has been an honor having you on the show. Ladies and gentlemen, that was Dr. Matare, an occupational medical practitioner at Northlands Medical Group, and alongside him was an occupational health and safety practitioner and chief consultant at OHSMS. Thank you for joining us on this discussion. Do remember to subscribe to our YouTube channel and follow us on our social media platforms.